Hello everybody, Dr. Doug Williams here from Care Chiropractic. This week's video blog, we're going to talk about pillows. We get that question asked a lot in the office, what kind of pillow should I use? The first thing that we always try to determine is someone primarily a side sleeper or a back sleeper? If you're a side sleeper, you want to maintain the angle between your neck and your shoulder at about 70 to 90 degrees in through here. If the pillow is too thick, it'll push your head up. If it's too thin, it'll crank it down, and that over time, over the night, can cause you some trouble. If you were to lay on your side on a pillow that was appropriate for a side sleeper, what should happen there is my head should be relatively in line with my torso, and that's how this one's going to accommodate me on that. So that would be normal for a side sleeper. If you're a back sleeper, you want to go ahead and maintain essentially your head over your shoulders. If a pillow is too thick, it'll push your head forward. So if I'm a back sleeper and I have a thick pillow, it forces it forward. That's not good. We want something that's relatively neutral, maybe a little bit extended. So again, demonstrating on this pillow, if I'm laying on my back, for the most part, my head and shoulders should be in line, maybe slightly extended on that. That would be an appropriate pillow for me on my back. The next question then is usually, well, what should I get and where should I get it? Usually, if you're 90% one way or the other, you should be able to find a pillow at a regular store that works for you. If it's a side sleeper, make sure it just keeps you in that position, and the 10% of the night that you're not sleeping on it, probably not a big deal. Likewise, if you sleep on your back, a thinner pillow is going to allow your head to be extended in there, and that's what you want on that. So if you're mostly side or mostly back, get either a thicker pillow for your side or a thinner pillow on your back. If you flip from side sleeping to back sleeping, which a lot of people do, you have several options. An easiest way with a conventional pillow is to get one that's thinner, and if you're on your back, it's unfolded so that your head is extended. If you're on your side, double it over so that your head can be in that close to 70 to 90 degree angle, and oftentimes that's all people need. You can do specialized pillows. We use one at the office called a D-Core that's thick on the sides and has a pushed out section in the middle for when you're on your back. So we like those quite a bit, and we use those often. There's a lot of other pillows that are on the market as well. There are gel pillows and there are husk pillows. There's My Pillow. To be honest with you, I'm not very familiar with those other than periodically people will bring those in. If you have one and you like it, stay with it. If you have one and you're not sure about it, check it for those two things, that it's thick enough on your side, thin enough on your back, and if you can make it work, then that's great. If not, you might want to go ahead and start looking around again. I will recommend that if you find a conventional pillow that works and you really like after a week or two, get two of them, because when that one wears out, you're going to go looking for one again in a store and you won't be able to find it. So get two, keep one in the closet for when it wears out. If you get any questions on this, just go ahead and give us a call back at the office. We're happy to answer them for you. If you're ever unsure and you want to bring in a pillow, we're happy to take a look at it with you and see how that fits. So have a good week and give us a call with any questions. Thanks.